Welcome to the Research Works podcast, live from the European Academy of Childhood Disability Conference 2024 in Bruges, Belgium. Join us for interviews with keynote speakers, world-renowned researchers and clinicians, and behind-the-scenes stories from one of the great paediatric conferences in the world.
Well, I have to say, though I talk about episodes being very exciting, guests being very thrilled to speak with, this one has taken 4 years for us to have a chat. Professor Bernard Dan, welcome to the podcast.
I'm very happy to be here at last.
Finally. And I think when we first met, it was when you were in Perth, back in 2020, when the world was just discovering about the pandemic. And I remember after the conference, everyone headed home as quickly as they possibly could. I remember that was the timing. And then I've seen you at conferences since then, but we've just never managed to cross over in time. I don't know how that's happened, but we're here today.
Yes,
Finally.
you know, I think I caught the last airplane leaving, and then I arrived home. My country was in lockdown.
Right.
And then on the following day, so I landed on a Sunday. Monday morning, I was supposed to give my first lesson at a university for a new course.
Yes.
But the university was shut, and I took the lead of the corona cell, as we said. It was a crisis cell.
Wow.
Very, very special period, I remember.
Indeed. I mean, to be able to, I remember I wouldn't say the word panic just yet, but there was definitely a sense by the time it got to the end of the conference, this was serious. Let's get on home again. And wow, what a privilege it is to be here now.
And my son had COVID at the time.
No.
Yeah. And at the yes, well, so when I got back, well, I knew I'd learned about it when I was in Perth.
Yeah.
And it took him 4 months to recover. But then one day he said, "Oh, I feel better and stronger than ever now."
Wow.
So that's good, and he's fine.
Wow. I mean, what a sense of urgency to come home at that point, right? Well, again, just so grateful to have some of your time today. I feel there's a lot of things that I always have questions, and to have access to someone like you who has the privilege of sitting on quite a number of really internationally based organizations. You know, you have oversight and you know where things are sort of headed. So not only are you editor for Developmental Medicine, Child Neurology, as many people will know, they submit to this journal, very prestigious, very highly ranked, and then also the scientific chair of EACD. You know, you see a lot of research come your way, and you lead the team, of course. What would you say is the big shift in research of late? Has there been many changes, or are you seeing it head in a particular direction? What are your thoughts on that?
I think there is more than one shift.
Yeah.
I think that there's big change. So within the field, it's like more interdisciplinarity, but we had seen that coming, and it's very good that it's there.
Yeah.
With that, sometimes we lose some of the expertise because of the interdisciplinarity. That means that every practitioner becomes a researcher, and every researcher can cover a range of topics, and they're not always supported by people who with technical expertise or conceptual expertise in the field.
Yes.
But this is progressing also because the publications and the research output is also interdisciplinary and should be looked at in this way. So a shift is more collaboration and not losing sight of the excellence of each of the fields that we're trying to bind together.
Yes.
So this is one. Another one is over the years in our field, qualitative research has really progressed.
Yes.
And that comes together with knowing more about methodologies. And this rigor and this need for methodologies has also affected the rest of research. And so I think that even in knowledge synthesis, when we're trying to say what we know about a topic, we're much more rigorous. We know better how to do it.
Yes.
And so this is really great.
Yeah.
But probably and there are more changes, of course. So you were mentioning when we were talking informally the change in name of the Academy.
Yes.
So last night we decided to change the name of the European Academy of Childhood Disability to European Academy of Childhood onset disability. And that was to reflect the attention that we have had over the years increasingly for the lifelong course.
Yes.
The global perspective, it has also become more important, and it is being represented at European meetings like this one that are truly international and intercontinental meetings.
Yes, absolutely.
So lifelong global perspective, and also the direct participation of people with lived experience.
Yes, yes.
This comes with challenges.
Yes.
That is, so we really need to make sure that people we call participants in research really participate and bring different perspectives,
Yes.
help in designing studies, in analyzing findings,
Yes.
and in spreading results and being part of discussion.
Absolutely. And to pick up on that point, there's a lot of points to pick up on, but for that one, you are so right in that. Even I was talking to Marco about this a little bit earlier. He mentioned that in the submission process, you wanted to really identify whether consumers were truly consulted, not even just consulted, they were part of the whole process.
And know what their role was.
That's
and actually, I
right,
wanted to be
yeah.
more radical. So
Yeah.
my original suggestion was to impose having at least one person with lived experience in the authorship of all submitted research. And then my colleague said, this is beautiful, and we should go towards this.
Yes.
But we're just not ready.
Yeah.
So we agreed that it would be important to measure where we are and measure where we'll be next year.
Yeah.
And then in a few years' time, hopefully, we will realize this important goal. And it's important because that's the essence of what we do.
Absolutely, absolutely. Well, certainly for me, when I was putting together my submission, it signaled to me this shift. It was almost immediate where I thought, wow, this is where we're headed when it comes to research. And, we involve consumers in everything that we do. I feel like it feels I'm probably part of the generation that's the recipient of all of this talk about what we should be doing, and we're doing it, and making sure that it's so central and integral to everything that we do. That has been, for me, one of the biggest shifts that I've noticed, and something that really encourages me to always be answering a question in a really authentic way, because there is, Christine Imms, she'll talk about participation, and I remember her saying, participation, there's two parts of it. You can attend and you can be involved. And it's the same in research. You can attend, you can be there, or you can be involved. And that deeper meaning of being involved has a whole new element to it in terms of the richness of what that can look like.
So some of my colleagues were a bit reluctant to start with because they thought we're going to homogenize the level of research towards something that is really can easily be translated, and then we might lose the basic science elements. What we have seen is that this is not the case.
Yeah.
And in meetings like this, and this is just a reflection of where the field is, you see a lot of diversity.
Yes.
And that is very important. Diversity in topics, in methodologies, in types of questions that are being posed. And what I feel is really rich is to have all this at the same place.
Yes.
So you can go here, you can go there, and you have people interacting.
Yeah, absolutely. What do you hope to see for the future? I think this conference is very unique in all the aspects that you've just described as well, and the collaboration. It's something that it's very obvious in this entire conference. Where do you hope to see the field go in the next few years? You seem to be quite a visionary.
I don't know. I do have a vision, but I'm not sure how strong it is. But I feel strongly about it. And what I can say is that. So I mentioned diversity, and I said there's a lot of diversity. Actually, there is more diversity, but there is very limited diversity. And so if you look at the people, their background, where they're coming from, and where they're going back to, with what has happened here, I think it's still quite limited. Okay. And in the future, I think that we will see this more, and we will be more, not just inclusive, but we'll go proactively.
Yes.
Working together with other people whom we don't see now. And this includes the very topic of disability, because
Yeah.
we think that this is our topic. We think we are experts, and actually we are experts. But when I go to other circles, to the humanities, to, well, other visions, other perceptions, other frameworks for understanding the construct of disability, I see that we are an island.
Yeah. Yeah.
And sometimes we do forget that we on an island and we have this sort of total view. And I'm going to say something even more radical. I mean, we have been cultivating this beautiful model of the ICF, of the International Classification of Function, and with a new understanding of health, also in positive aspects, and all these different dimensions. What I now realize is that it is placing the people in healthcare in, or keeping them, if not placing them, keeping them in a power position in understanding every issue as being related to health. You mentioned Christine Imms. Christine Imms
Yes.
is teaching us so much about how to think in terms of participation.
Yeah.
And we see societal participation as health. And this is very healthy for us. But what we should not overlook is that there are other models than health, and justice, for example,
Yeah.
making sure that equity is respected,
Yeah.
or sustainability, making sure that what we do is also for the benefit of future generations.
Yes.
These are other perspectives,
Yes.
and they do not align as they are with the ICF.
Agreed.
So we should go and meet with other
Yeah.
people, hear other perspectives,
Yes.
and make a wider perspective where we can find a better way of helping people.
That is brilliant. And I would say a wonderful example of that was the first keynote, where we had them here on the podcast. I was speaking with them, and I said, "Oh, this is a very interesting combination." I have to admit, when I sat down the keynote, I thought, "Okay, we've got a clinical geneticist and Sally. Then we have Kath Haslam, who's a neuropsychologist or clinical psychologist, and then there's Alex Haslam, an organizational." And I thought, organizational psychologist. And I thought, how does this work? And they were attributing a lot of the fact that they came together, attributed to you, saying that we didn't know either. But after Bernard brought us together, we thought, wow, you see things in such a different way. Even how Alex was saying to Kath, I've been to your conferences, I'm often on the fringe, never really sit into it, but now I'm thinking about it and go, I think there's something to offer here, another perspective. And that was enlightening, Bernard. That was truly brilliant. I loved that.
Yeah, and I must say, I was very happy with the fact that it was the opening keynote lecture, because I think it set the tone, not only in content that was really, you say, to the fringes, and that was one of the points.
Yes.
But also to freedom. We can meet, we can think together,
Yes.
and something can emerge.
Yes.
And we have said things during that session that was not prepared. Darcy Fellings had a very beautiful description of it.
Yes.
She said to me, it was very clear that it was well-prepared improvisation.
That's
so
a
it
beautiful
was.
way to say it. Yeah, it truly was. It was something that when you have people who are experts in their field, who are willing to work collaboratively, and they can contribute for a common cause, and you could see that come together so beautifully. And I could see the excitement on their faces when they were brought together as well. They were all shaking hands with each other, going, "This is just so wonderful. When can we do this again?" Bernard, when you see a lot of researchers, a lot of clinicians listen to this podcast, and they'd be submitting their articles, they'd be thinking about, the process of research, getting involved. From where you stand, what kind of advice do you have for these researchers about, the papers they're preparing, the research they want to embark on? What's your pearls of wisdom? Because I feel like I need that too.
So I think that one important point is to know what you want to do.
Yeah.
So of course, we work in research project,
Yeah.
but I think it's useful to frame the question in a way that it rests on existing knowledge, existing questions, and see how you can effectively move move the question further.
Yeah.
Doesn't mean change the world. I
Yeah.
don't think this ambition is ever a realistic one, but adding something to what you do. I think that rigor as a guarantee that what you're adding is adding, that's also important.
Yes.
And then there is the storytelling aspect. And so you
Yes.
started with a question,
Yes.
and you have to convey it in a way that inspires people, and that can then be taken on
Yeah.
further.
Yeah. Yeah. No, that's so important. Sometimes it's they're the basic things to make sure we know, but to keep us focused on what we need to do. And a question I've sort of been really thinking about in speaking with a lot of people at the conference lately, we all want to have methodologies that are robust. The RCT is usually the gold standard, but we're seeing a lot of adapted clinical trials now, registries, a lot of different methodologies. We just mentioned qualitative as well.
Single case
Single case.
experimental
Oh,
design.
I love single case experimental designs. What would you say to people when they're thinking about their methodology? Because RCTs still most certainly have their place, but where would you head? What do you think is going to be a good way for clinicians and researchers to embark on research that's really meaningful?
Well, for the moment, but it's the bias of the moment. I'm very excited about adaptive platforms, about master protocols.
Yes.
And I'm very excited because I have seen how effective it has been in other fields, like in oncology, in infectious disease, or in intensive care. And I see in our field, so pediatric neurorehabilitation, rehabilitation in general, cerebral palsy in particular, that a lot of people have been engaged in research, but results have not been accruing.
Okay.
And so I think that it's important to find methodologies, on the one hand, that brings us together, that allow us to have more people involved, and also really feel that you can move forward with some flexibility. And for the moment, I like adaptive trials, but what I think is important is to keep a very open mind for methodology and applying them as they produce results.
Yes.
And this is not easy.
No, it isn't.
And
easy,
sometimes it asks that we go and team up with people from other fields, and that would be the best. We mentioned qualitative research.
Yes.
The people around me who are good with qualitative research are not very close to me, but they're around me. They're people in nursing. And so what I do is I cross the corridors, I go to people in nursing who have this experience of the strength, but also the challenges associated with qualitative research. And so I think that if I want to embark on something with a new methodology, I should not just do it from the book. I should involve people who have been using it.
There's a lot of expertise out there, isn't there? So final question, Bernard, this is a big one. In 10 years, what would you like to see a conference like this look like?
I want it to be much more dynamic. So for the moment, well, we've been experimenting with formats here, but I hope we'll have much more innovative ideas about formats to promote more interaction.
Yeah.
Because the interaction here is mostly the informal moments, which is absolutely great and very useful, but we give relatively little time to discussion and to discussion in that is effective. So I think that technology will help us. I don't think that we will need to have so many physical meetings as we have had. And I think that I want to be inclusive. We're speaking English, but a lot of people here don't easily speak English. And I'm sure that in this short time with processing of information, I'm thinking of artificial intelligence, but we're naming that now, but it's been around for a long time.
Yeah.
But there's acceleration. So I'm sure it will be very different. And I want these meetings also to when there are meetings, nodes, that they promote something that can really happen in a collaborative way between these nodes, and make sure that we have a system that can scale up where we are, and also, well, feel the path that we're taking.
A great vision, and I can't wait for that, and really excited where things are headed. So Bernard, thank you very, very much. Very busy man. And this is the end of day 2. So grateful for your time to speak with us today, and congratulations on a wonderful conference.
Well, thank you. Thank you so much.
Thank you to all of our listeners. I hope you enjoyed that as well. That was really incredible. But stay tuned. There's more episodes to come. Talk to you later. Bye.